My name is Mandeep Othee, MD. I'm a specialist in physical medicine and rehabilitation, as well as pain management. I work at a medical center hospital. I've been working there for the past 10 years, and this is Ask a Doc. What exactly do you treat as a pain management provider? I treat back pain, neck pain, hip pain, knee pain, any sort of joint or extremity pain or musculoskeletal pain. Do you treat chronic pain? Yes, I do. A lot of my patients are chronic pain patients. They've had pain for at least 6 months to a year, and we treat them with a variety of treatment options. What is the best way to keep track of pain? The best way to keep track of pain is by keeping a pain log or a journal. And in the journal, you would write where is the pain located, how long has it been there, what the quality of pain is, what on a scale 1 to 10, how bad the pain is, what makes the pain worse, what makes the pain better, and other things like that in the journal to help diagnose and treat the pain appropriately. How do you use Botox and stem cells in your practice? So Botox, we use Botox in our office for a variety of treatments. One is muscle spasms or spasticity, and patients who have neck pain or back pain suffer from those symptoms. We also use Botox for headaches, chronic migraine headaches. It's a treatment to prevent the headaches from occurring more often. As far as stem cells, we call it regenerative medicine, is what we call it now. And the reason why we call it regenerative medicine is because we restore, replace, and renew those tissues by using these treatment options, which are from amniotic fluid, umbilical cord samples, and it regenerates tissues. It's very fascinating and interesting stuff. It works really well for any sort of pain, especially for inflammation, back pain, neck pain, knee pain, or joint or extremity pain. What are the other possible treatment options? Some other treatment options include medications such as anti-inflammatory medications, muscle relaxers. We do some muscle injections in the office called trigger point injections. We prescribe physical therapy options or recommendations. We also prescribe chiropractic treatments in certain cases as well. Along with this, we do joint injections in the office. For example, knee pain, joint injections in knee, hip pain, hip injections, shoulder injections. And as far as other issues, back pain, neck pain, we do other options for that too. Treatment options include injections, nerve blocks, nerve burning procedures to help patients as well. So we do a variety of treatments, starting from minimal stuff, which is anti-inflammatories and muscle relaxers, all the way to almost surgical options, near surgical options, to help patients avoid surgery with procedures to burn off nerve endings called ablation procedures. What pain management options are the safest and most helpful? The most helpful and safest methods of treating pain is to help prevent the pain from getting worse, meaning that treat the pain right away, immediately, either with physical therapy, anti-inflammatory medications, simple home exercise programs like keeping the core muscles of your abdominal contents strong, stretching the back muscles out, keeping your neck nice and loose, your shoulder muscles nice and loose. It's very important to mobilize yourself. Mobility is very important for pain management, keeping yourself mobile and active. And once the patient becomes inactive, that's when the pain symptoms worsen. What new treatment options are you most excited to offer patients? We have 2 exciting treatment options for headaches in our office to prevent headaches from occurring more often, or prophylactic use. One of the treatment options is Botox, where we inject different muscles of the face, different muscles of the neck and the head area, as well as the shoulder area, to prevent headaches from occurring or helping the headaches from getting worse. That's one. The second thing is we just started this new option called Vyepti. It's an infusion every 3 months. I believe we're the first physician office to do this in this area. Every 3 months, we offer infusions for patients. And by giving this infusion, it's a 30-minute infusion every 3 months, once in the office. By doing that, the patient can avoid headache medications or avoiding too much use of headache medications. It's like Botox or other injectables, but instead of getting an injectable at home, once a month on your own, you can come to our office and get a once every 3 months infusion of this Vyepti medication, which is very interesting and very unique, and it works really well. And it's covered by insurance too. What are the next steps if the recommended treatment does not work? So for example, we always assess every patient we see. Some patients would benefit from therapy, some patients would benefit from injections, and some patients need immediate surgical evaluation. So it depends on the patient. Some patients would need surgery after the procedures don't work. Some patients may need procedures after surgery doesn't work. Some patients may just need a little bit more therapy or a little bit more exercises. We document these things and discuss this with the patients and formulate a treatment plan individualized to each patient. There's no cookbook formula on treating patients' pain. Everyone's body is different. Are there self-care options that can supplement medications, physical therapy, etc.? Yes, as I mentioned earlier, besides anti-inflammatory medications and muscle relaxers, mobility, keeping yourself active, keeping yourself busy with activities, stretching the neck out, stretching the back, stretching your shoulders and knees, keeping your muscles strong, working out. Those are important things. Lifting techniques, keeping your back straight, bending your knees when you lift an object off the floor. Besides that, injections and eventually surgery may be needed, but we do all these things to help patients restore function, getting them back to their families and their friends and also their job. We want them to become a productive part of society, not just sit at home all day taking medications. We want them to be up and active and doing things. And the patients love that too. We enjoy that, and I like treating people that way too.